right? Some of your reactions. So you were able to, listen to Dr. Halamka and the things that Mayo Platform are doing for for their their vendor partners, right? So just from your point of view, working directly with progressive HIT companies, what are your thoughts on the work that Mayo Clinic Platform is doing to assist the HIT companies out there? And how do you see that influencing the market?
Actually, in a very, very big way. I will give you actually an example. Think about, you mentioned 3 companies. Let me take those same 3 companies, MedTel, Extrico, and DocHealth, right? MedTel, if I will explain a little bit what MedTel does, they basically provide a lot of value through actually surgical workflow automation. By actually the MCP platform on their side, they can actually seamlessly give their product to many, many healthcare systems. And you have worked in as an EHR vendor, how hard it is to actually integrate with those systems. Not even hard, means to cut that red tape to reach to that data is actually a months, not weeks process, right? So and the kind of visibility MedTel kind of company can bring to the surgical workflow is going to be amazing. And at the same time, they can actually say that, in your surgical cases, I'm going to increase the efficiency, operation efficiencies, clinical efficiencies, financial efficiencies. If you talk about Extrico, say, for example, the Extrico, John point was very right, very, very much resonated with me is the trust. So when Extrico is going to make a claim that they, as an analytics company, I am going to save you X dollars, then that statement is actually has more trust because if they have gone through the MCP selection criteria, but at the same time, they have actually that data ecosystem in a de-identified fashion, they can actually prove that value. And because these healthcare systems only has given that data, they know that this is their own data. It's actually going to have much more trust that if you are saying that you're going to save me 10%, 20%, 1%, whatever that might be, the person, it is much more reasonable in their eyes to understand and absorb as well. So in my opinion, it is actually huge value for all the parties which are going to be part of the data ecosystem. But I will say the other way around also is that there is a lot more these companies are going to offer as well to the MCP as well. It's not one way, but at the same time, all the companies which are going to be part of this data ecosystem now, they not only have the data ecosystem, which of course is hard to do and bring all those countries and don't let me even start on the legal and regulation part. But that's actually very, very good value proposition these companies are actually going to bring to the whole data ecosystem itself as well. So how their workflow solutions like DocHealth is going to help the data ecosystem itself as well.
Right. And you mentioned, the data integration, as an issue with the EHR. So I want to bring up something that John said and get your feedback on this, right? Sure. He mentioned OMOP, right? So there, I've had a lot of conversations recently about OMOP. John, obviously, and the Mayo Clinic are really pushing, I think, in that direction to make sure there's a standardization of a data structure, right? I've had nice chats with folks like Frank from, who originally was from IMO and now runs the Leap of Faith organization, who he is the father of the IMO identifier underneath the procedure dictionaries for interoperability and reporting, right? He also is big on pushing and very bullish about OMOP, right? So in your experience, what do you think about that strategy? Is trying to get everyone to that lowest common denominator of an OMOP structure, and what do you see the challenges with that?
I mean, in my opinion, I think the standardization always improve the interoperability, right? but how you will actually move the organizations to adopt to that standard. Because I will actually just tell one statement which I heard. I have not that one of the top EHR vendor CEO basically said that there is no data interoperability issue when every healthcare system will be using my EHR product. I think you got about whom I'm actually talking about. So there are actually going to be the companies who may or may not be thinking from an data interoperability perspective, because sometimes it is going to actually hurt them than actually help them. But as an organizations, various organizations who are actually trying to work collaboratively and in this data ecosystem, I think the standardization is actually important. I would basically, in the past, we have built many data ecosystems as well. We basically built the de-identified solution, the patient matching, which is actually currently used by more than 7,000 hospitals, 18 of the 20 pharma companies, and 500 real-world data providers use that. But just having this, a standardization approach to the data, and then how that data get actually linking, we spent, as John mentioned, we spend about 40 to 50% of our time in data cleansing, data linking, data standardization. Wow. So when he basically talked how we can come from 18 months to 18 hours, I think it's 18 hours is not something I'm seeing it, at least in a couple of years down the road, but I definitely see a huge opportunity that we can actually bring it to the 10%. Instead of 100% time, which we are spending.
And I think you brought up a good point, which I just want to highlight. I've spent many years as a champion for interoperability and came from one of the large EHRs who are trying to push that. And yes, there was a moment in time where I think it was a threatening thing for EHRs to think about being interoperable. They thought they were giving away some of their secret sauce, and they wanted to hold on to their market share. And I think, for the most part, I'm not saying that's completely gone, but I think the attitudes have really changed, and I think the steps that we've taken with interoperability have actually brought more business to the EHRs if they really took a step back and looked at it than it did lose them. Right? In other words, the ability to allow third-party types of tools that are not in their wheelhouse to create normally. Let those experts do those things and plug in and make that ecosystem much more interchangeable, interoperable, etc., is going to be better. And I think I truly believe that the next race, and this is with this in mind, meaning, AI transformation, also with TEFCA coming out, right? I think the convergence of those two things are really starting to meet. And John mentioned that to a certain extent when he started talking about the FHIR accelerator, right? So you're talking about, forget FHIR. What you're talking about there are opening up additional data elements, which opens up more use cases, which brings in more solutions that can help you, right? So the more I think that the EHRs embrace moving to a standard system outside of theirs and not just an ODBC compliant system like Clarity or data repository, etc., but actually getting to an OMOP state is crucial for that, but also is very complementary to what the QHINs are trying to do and the other HIEs that are out there trying to do, right? And I think there is a moment of convergence coming soon. Sorry, go ahead, Deepak.
I will agree with you, but I think I will just like to highlight also that a company-controlled system and data interoperability provided by different vendors versus a data ecosystem is actually also a game changer. In a sense, I'm a true believer where the complex network of interconnected entities working for a common goal is actually going to be a hub and spoke kind of a model where every Every decision is actually taken by a central hub, and others are actually just the user of it. To be frank, I mean, like if you think about New York City, like they have 5,100 life sciences company, 100 incubators, 120 universities, and New York City, where you and I live, actually, Larry, these startups gets the maximum funding from National Institute of Health. So just think of the ecosystem, how big this ecosystem can be. And I just talked about the New York City, and there are many cities, Boston, San Francisco, Nashville, now then San Antonio and others are even coming up. So there are a lot of actually those entities, and having a data ecosystem, then actually a product approach and integration to that is actually going to be the game changer, in my opinion. And I think hopefully all those both will actually emerge to help 4 billion patients in general. And I hope actually this 4 billion number actually becomes 6 billion soon as well. We don't have to target 4 billion. Probably we can actually bring other also in the digital era. So the pie keeps on increasing as well.
Agreed. No, great topic there. And I want to transition for the last question that I'm going to ask you, and it's come up in, from the audience as well. I think I'm kind of amalgamating a couple of things together here for you, but you've worked, as we've established already, and dozens and dozens of HIT companies, helping them take those steps forward, right? So what would you say are the first step forward as an HIT company? What are the things that they really need to think about as their first step moving in that direction? Right now they have a solution in place. It's not leveraging any AI. They want to introduce that as an organization and develop that. What is the first step you take?
It's a very interesting question, but I think there is not one answer actually applies. In my opinion, I think there are two approaches I will definitely suggest. And that is dependent on the size of operations or size of your initiative, to be frank. Suppose if you want to move quick and then you want to basically not think about everything, but you're just focused and then get things done. In those cases, we have actually even organized a 2-hour executive meeting with 5 questions which we want to talk about only. 1, what is your KPI goals? What are your pain points? What data you and your team doesn't have today to do your job today? Then we basically have questions like what compliance or missed steps done by your team causes the biggest headache for you? Or the 5th question is like, what are the most time consuming tasks for your team? And we have basically found either if by discussing on those and having different people actually put down on the board that these are actually the different items in these categories, and each one of those members keep on actually adding that, okay, plus point to this, minus point to this, we have been able to come up with actually the prioritized AI use cases out of that meeting itself. And sometimes actually team members know, I basically have this particular problem. I really just want to solve it. So that's kind of like easy. In that particular case, we just have to get into the discussion. Okay, what is your process going to look like today? Or what is your process today and what you want it to look like, and how we will basically build that AI model with the data which you have today, and how that will flow or change the user experience and the values. But in case if you have a very large organization and then you're thinking, okay, I'm going to convert either a department or an organization to an AI-enabled organization. We have basically many of those cases as well. In that, we basically normally suggest a methodology which has 4 phases. Discover, strategize as a 2nd phase, The third phase is the plan and act. And the fourth is actually adopt and optimize. In the strategize, we are actually looking at the vision. We are assessing their technology, people, and processes, which they have it today. Their as-is process, not only one process, just now we are actually looking at multiple processes within the organization as well. In the case of strategize, we actually help them what will be you see as a to-be process going to be, and help them prioritizing the AI use cases, especially on like the criteria you mentioned, ROI, but we basically prioritize on 3 criteria. What is actually the efforts it's going to take to build it? And of course, the second is that what will the value it actually create? And the third is that how easy it is going to be to adopt. And that basically identifies the ROI of that AI model. So that's how the approach I will suggest to our audience.
That was fantastic. We went a little bit over, but it was worth actually getting those last bits of information and advice from you. So I appreciate that. Thank you everyone for joining us. One special thank you to Dr. John Halamka, who's probably on a plane right now. Thank you, Deepak, for your insights. This is a first of a series that we're going to do. I thank everyone for joining us. We will be sending out a survey. We would really appreciate you filling that out. And then within the survey, if you can actually just dig, specifically put in there maybe future topics that or questions that we can address later on. Anyone who wants a copy of this, we will be posting this to LinkedIn. And once again, we really appreciate your time. Sorry, we went over a little bit, but it was a lot of information to pack in within an hour. And I thank you all for giving me your attention and appreciate it. And we'll see you in the future.
Thank you very much, Lawerence.
Thank you.